Welcome back to the Virtual Massage Clinic. My name is Michelle, and today we're going to talk about how to write a treatment plan. Now, if you're in massage school, it's probably a term you've heard thrown around, and you're wondering, what the heck is a treatment plan? How do I write one? Why do I need one? We're going to talk about all of that today. First, let's talk about what a treatment plan is. So, usually in massage school, a treatment plan is talked about as a long-term plan, so multiple massage treatments. So it's the plan for how you treat your client over multiple treatments. In reality, a treatment plan can be that, but it can also be your treatment plan for the day for an individual session with your massage therapy client. Let's talk about both. So when you are writing a treatment plan, writing is a very arbitrary term. While you're in school, you may actually have to physically write a treatment plan, but when you're in practice, you may not ever write one, but it's definitely, at the very least, something you mentally need to think about. So the reason why I say this is because a treatment plan gives both you and your client a plan. It gives you objective goals. It gives you a timeline. It gives you accountability. And at the end of the day, I always say this in all my videos, but it helps you make more money. Because when you have a treatment plan, make sure it's ethical and honest. You're essentially rebooking your clients and proactively saying to them, you're communicating to them, you need to come in for more than one treatment. Now, if they only need one treatment, don't put them on a long-term treatment plan. Most conditions require more than one treatment, and so you put them on a treatment plan. And this is not being salesy, this is being ethical. If you hold back information from your client that could actually potentially help their health, you're not being a healthcare provider. Don't be shy to communicate to your client that you're gonna put them on a treatment plan, and you don't even have to use those words, really. You can communicate your treatment plan to your client by saying something like this. I expect to get really great results today working on your blah, blah, blah. However, I think that we won't get through all of it today. We're going to need to have multiple treatments in order to fix, resolve. Don't use the word fix. You could say, I would like to continue working on your X condition. So let's say hamstrings. I would like to continue working on your hamstrings to continue to, and then state your objective. So you're making it really clear to the client that your intentions are pure. You understand what they want. They want to be out of pain or whatever their condition is. And you're letting them know that it's going to take X number of treatments. So you're putting everything, all the cards out on the table. And when you do that, you're essentially putting it on the client to say, to step away. If they don't want to rebook, then they're stepping away from the possibility of healing their condition or the reason that brought them in the first place. Treatment plans are a wonderful thing. Let's dive into my computer and talk about how to write them. Okay, so treatment plan is a plan for one or more treatments and includes goals, objectives, and a timeline. We've talked about this. So let's say the goal is to correct a client's hyperlordosis. That's a great treatment goal. That's the start of your treatment plan. And the timeline would be, for example, let's say you think you could correct it in 2 months. These are arbitrary numbers. You may say to your client, so your treatment plan may include 2 treatments a week for 8 weeks over the course of 2 months. So that's your timeline. Every single treatment plan has a check-in point. If you have got multiple sessions set up with your client, or you intend to, make sure you've got a halfway mark. So if you think that their condition is going to be resolved over 8 weeks, then what you want to do is say after 4 weeks, 3 or 4 weeks, around the halfway point, evaluate if change is being made. And again, this is also the value of a treatment plan, because your client knows that you are accountable to getting results for them. You never want to waste your clients' dollars or time, and you want to make sure that you're doing your very best to get them the results they're looking for. So what we're going to do in writing a treatment plan, we're going to determine first our top level goals. Earlier, I used the example of a hyperlordosis. So if the client has a hyperlordosis and it's causing them low back pain, for example, your high-level goal is to decrease the hyperlordosis. Now, how are we going to do that? And that's where part 2 of the treatment plan comes in, which are the objectives. We're going to break that big goal into smaller objectives. So the objectives are, in a hyperlordosis client, to decrease an anterior pelvic tilt, to strengthen the glutes, strengthen the hamstrings, encourage a posterior pelvic tilt, strengthen low core, lengthen the quads, for example. So those are all your objectives of treatment. And then timeline, this is really highly subjective, depends on your professional judgment as well as the client. Every client is unique and individual, so there's no one answer for all of them. But you're going to determine how many treatments they need to see and how frequently they need to have them to get the results that you think they need and that they want. So how do you communicate your treatment plan, aka how do you rebook your clients? This is a really important topic. Don't go yet because you need to listen to this. The best tip in the industry is to talk to your client while they're on the table. So have conversation during treatment. By the end of the treatment, there's no need for you to be like, okay, so can we rebook you? That should already be a discussion you've had while you're on the table. And there's really graceful ways you can do this that are non-salesy, that are non-threatening to both you and to your client. So you can use language like, oh, wow, we're getting amazing results today. This is great. I'd like to continue working on you. Or you could say something like, in order to achieve X results, I recommend X number of treatments over X course of time. I expect to get great results today, and I think we can do this to the muscle. However, I do believe that more treatments will be necessary to achieve whatever. You could say, I'd like to rebook you for the next 8 weeks or whatever to continue working on ... Another good one is, I'm sorry you have pain in blank. Let's continue working on your blank next week to help you get out of pain as quickly as possible. So it's really that easy to write and communicate a treatment plan. Now, when you are rebooking your client and they're off the table, number one tip is to recommend the same day and time. You already know that your client is available, especially if they're a 9-to-5er, they've come in for a 7 o'clock appointment. You know that that's a window that works for them. So you can offer them something like that. If you are self-employed and in private practice, I do not recommend booking your client more than 1 month out because you are in control of your schedule, and I speak from experience. You may decide you want to take some time off next month. That's the joy of being self-employed. So do yourself a favor and only book clients a month in advance. At the beginning of the video, I also mentioned we're going to talk about treatment plans for an individual session. So it's basically like a longer term treatment plan condensed into one. So this is when you decide after and during the intake with your client, you're thinking to yourself, what does this treatment look like with this client for today? So what are my goals? What do I want to achieve in this 1 hour that I have with my client? What are my objectives? So how am I going to accomplish those goals? So if it's to take them out of pain, how am I going to do that? Okay, well, I'm going to work on this, and this muscle. And timeline. All right, so I'm going to work on this muscle for 10 minutes, another muscle for 10 minutes, and her entire back for 30 minutes, something like that. A treatment plan can either be for one singular treatment or for multiple long-term treatments. And it's really not as complicated as it sounds. It's a means of organizing your thoughts, your tactics, and your accountability to your client. My last and best tip for you is if you do feel salesy or if you feel like it's too much to ask them to commit to 8 different sessions over the next 2 months. Another approach to ease your concerns and ease theirs is to say to them, I think it's going to take about X number of treatments to resolve this issue. However, I'm hoping it takes less than that. So how about we book you in for the next 8 weeks, and if the results are great in the next 3, then we'll just cancel the other ones. Something like that. And this shows your integrity, this shows your honesty, and it really just helps you build a better, stronger relationship with your client. And at the end of the day, make more money. Thank you for tuning in. And if you want to discuss this further, please head over to our Facebook group, Massage Students. I'll link it below. And that's where we have discussions about this type of stuff on the daily, as well as client scenarios. Can't wait to meet you in there. Say hi on Instagram. I'd love to talk to you. Ciao. See you in the next one.